Namaskar. With the rising number of COVID cases in Delhi, the Union Home Minister Amit Shah chaired a high-level meeting today, and several measures have been put in place to stem the rise in the midst of the pollution concerns as well. So the COVID situation in the rest of the country has been showing a declining trend, signaling a successful collective coordinated control strategy. And that's in focus tonight. Let's begin with the headlines. My name is Mark Lynn. Nitish Kumar set to take over the command of Bihar yet again, elected leader of the NDA legislature party, to be sworn in on Monday. The BJP elects Tarkishore Prasad as the leader of the legislature party and Renu Devi as the deputy leader. Union Home Minister Amit Shah chairs a high-level meeting in view of the increasing cases of COVID in Delhi. The Union Health Minister Dr. Harshvardhan and Delhi's Chief Minister Arvind Kejriwal attend the Coordination Committee meeting. 12 instructions issued to fight COVID in Delhi. RT-PCR tests to be doubled in the national capital. Hospitals' capacity to be utilized at the optimum. India continues to fight COVID-19 pandemic. The nation registers less than 50,000 new cases for the 8th day running. The recovery rate has increased to 93.09%. India rebuffs the Pakistan government claims and rubbishes the so-called proof against India. The MEA says that the proof enjoys no credibility and is fabricated and represents a figment of imagination. Diwali festivities make Delhi air worse. The NCR bears the brunt as people ignore appeals and their own safety concerns to burst crackers on Diwali Eve. Showers cool northern plains as weather conditions in the hills cool the air in Delhi NCR. Snowfall in Pir Panjal range. Mughal Road is also blocked due to snow. The iconic Bangla actor Soumitra Chatterjee is no more, recipient of the Dada Saheb Phalke Award and also the Padma Bhushan and 3 national awards. President Ramnath Kovind, Prime Minister, condoled the loss. One person stabbed and at least 10 arrested after a fight breaks out in Washington, D.C. between supporters of the U.S. President Donald Trump and counter-protesters. The melee occurred following a march through downtown Washington by tens of thousands of Trump supporters, echoing his unsubstantiated claims so far of election fraud. Our top story, Nitish Kumar is set to take over the command of Bihar yet again. He was elected leader of the NDA legislature party and will be sworn in on Monday. The BJP elected Tarkishore Prasad as its party leader in the legislature and Renu Devi as the deputy leader. Here are the details.
Nitish Kumar is set to continue as the Chief Minister of Bihar. He was elected as the leader of the NDA at the alliance meeting in Patna on Sunday. Senior BJP leader Rajnath Singh presided over the meeting at the CM's residence in Patna. Alliance leaders Jitan Ram Manji of Hum and Mukesh Sahni of VIP were also present.
विधायक दल के नेता नीतीश कुमार जी निर्वाचित हुए हैं और भारतीय जनता पार्टी विधायक दल के नेता श्री तारकिशोर जी और उपनेता श्रीमती रेणु देवी निर्वाचित हुई हैं और नीतीश जी के साथ सभी लोग महामहिम राज्यपाल महोदय से आज मिले हैं। डिप्टी सीएम का फैसला तो यह सब बैठकर करेंगे लोग।
After the meeting, Nitish Kumar proceeded to Raj Bhavan and state claim to form the government. He'll be sworn in as Bihar's next chief minister on Monday.
ये विधानमंडल दल की बैठक हो गई, उसमें फिर मुझे नेता के रूप में निर्वाचित किया गया। महामहिम राज्यपाल महोदय को उसका पत्र आज अभी दे दिया गया और उन्होंने इसको स्वीकार करते हुए मुख्यमंत्री के रूप में मनोनीत कर दिया। इसके बाद हम लोग बैठ कर कल शपथ ग्रहण समारोह होगा कल 4 साढ़े 4 बजे जो भी होगा आफ्टरनून में होगा, और उसके बारे में कितने लोग शपथ लेंगे, इन सब चीज़ों के बारे में अब निर्णय होगा।
However, Nitish evaded questions on the issue of cabinet formation, just adding that the government will take all the people from different sections of society together and will work for all.
से काम करना पड़ेगा और तेज तौर पर, ताकि बिहार के लोगों ने पुनः अवसर दिया है बिहार का और आगे विकास हो, और उसके लिए सब मिलकर के काम करेंगे, कहीं कोई कमी न रहे किसी भी क्षेत्र में, और समाज के किसी
कल कितने मंत्री शपथ लेंगे
सब लोग करेंगे।
Earlier, Nitish Kumar was elected as leader of JDU's legislative party. Meanwhile, newly elected MLA Tarkishore Prasad has been elected as BJP legislative party leader in Bihar, while four-time MLA Renu Devi has been elected deputy leader of the legislative party.
इस कार्यकाल में विधायक दल के नेता के रूप में एक बड़ा दायित्व मिला है, और उस दायित्व का निर्वहन हम बेहतर ढंग से करेंगे। जो संसदीय मेरा अनुभव रहा है उसका लाभ मिलेगा, और फिर जो दल और हमारे जो नेता हैं उनके साथ बेहतर ढंग से काम करेंगे।
Nitish Kumar has been a prominent face in state politics for about 4 decades. He will take oath as Chief Minister for the 7th time on Monday. Starting his political journey as a friend and companion of Lalu Prasad Yadav, Nitish Kumar later broke away and formed Samata Party. Later on, he merged his party with the JDU and thereafter dominated the caste-ridden, steeply divided Bihar politics, and he gained considerable goodwill, especially among women voters, after taking a tough decision to enforce prohibition in the state. His appetite for development works has earned the nickname Sushasan Babu, and that is exactly what the people will still want him to do: work for development of the state for the next 5 years. With Dheeraj in Patna, Newsnight Desk, DD India.
Well, India has been seeing less than 50,000 new daily cases of COVID for the 8th consecutive day. In the last 24 hours, 41,100 persons tested positive for COVID in India. COVID-appropriate behavior among the varied population groups has reinforced this trend. And it also assumes significance as many countries in Europe and America, they continue to see a surge in the daily cases. The government has been working relentlessly to see the COVID infection in India remains within control. It has been a challenge, but the efforts have been successful. Close monitoring of the virus in different parts of the country has helped the test, track and treat policy over the last 8 months. There has been an overall and steady decline in the number of active cases across the country, but in Delhi the cases have been on the rise. Union Home Ministry convened a meeting of the Coordination Committee on Sunday evening. Delhi Chief Minister Arvind Kejriwal, Union Health Minister Dr. Harshvardhan, Union Health Secretary, Lieutenant Governor of Delhi attended the meeting, chaired by the Home Minister Amit Shah. Amit Shah detailed the COVID fight plan with 12-point instructions. The RT-PCR tests will be doubled in Delhi. The testing labs in the capital will be used to the optimum, and Health Ministry and ICMR mobile testing vans will be stationed in vulnerable areas. The central government has put in place a systematic mechanism to deal with this pandemic at the national level. The results are clear for all to see. Fewer than 50,000 cases of COVID-19 have been reported every day for the last 8 days. The last time more than 50,000 cases were seen was on November 7. In the last 24 hours, only 41,100 persons have been found infected with COVID in India. At the same time, the number of people recovering from COVID has been increasing steadily. In the last 24 hours, 42,156 patients were cured and discharged after treatment and monitoring. The active number of cases is only 5.44% of total cases, and the recovery rate has risen to 93.09%. The cumulative number of cured patients is 82,05,728, which is by far the highest in the world. The decline must be seen in the context of the rising number of cases in Europe and America, which has necessitated the reimposition of a lockdown in some parts of those countries. At the heart of the strategy in India is the focus on testing. There has been an average of 1 million tests a day, and between the 12th of November and the 14th of November, a total of 48,36,819 tests were done. With a focused containment strategy, the government has restricted the spread of COVID, and even today, 83% of all cases come from 10 states, union territories. In 21 states, the fatality rate is less than the national average. Meanwhile, work on a vaccine has been progressing rapidly. On Sunday, the Union Health Minister told Doordarshan that he hoped a vaccine for COVID-19 would be available in the country in the first or second month of 2021. That's not far away.
दुनिया के अंदर 200 से ज़्यादा वैक्सीन कैंडिडेट्स हैं, उसमें से थोड़े से क्लिनिकल ट्रायल्स में एडवांस स्टेजेस में पहुंच गए हैं, 3-4 हमारे भारत के हैं उसमें, और उसमें से भी 2 तो थर्ड फेज में पहुंच गए हैं। और उस सब के आधार पर हमें उम्मीद है कि जैसे नया साल शुरू होगा 2021, तो पहले महीने में नहीं तो दूसरे महीने में हमारे को निश्चित रूप से वैक्सीन उपलब्ध हो जाएगी।
The onset of winter, coupled with the festive season, has added to the concern of a potential spike in the number of COVID cases. But responsible behavior by citizens and effective management by the government has blunted the surge for now. But as the winter intensifies, that threat continues to be a clear and present danger. So responsibilities also scale up accordingly. Hence, take all precautions, wear masks, keep a distance of 2 yards and avoid unnecessary social engagements. That way the country will continue to succeed in controlling the corona infection. Newsnight Desk, DD India. Well, that high-level meeting to review the increase in coronavirus cases in Delhi and the available medical infrastructure, let's look at some of the key points at that meeting. The RT-PCR tests in Delhi will be doubled, mobile testing vans to be deployed in high-risk areas. Also, they're going to make maximum use of the testing capacity in Delhi, and the bed capacity and related medical infrastructure will be increased. In fact, 250 to 300 ICU beds will be added to DRDO's COVID hospital in Dala Kwan, and about 10,000 bed COVID center in Chhatarpur also will be strengthened, and there will be an increase in the availability of beds with oxygen facilities over there. Some MCD hospitals also will be converted into dedicated COVID hospitals. So these are for patients, in fact, with mild symptoms of COVID-19. All private hospitals also have been clearly asked to indicate the availability of medical infrastructure with regard to COVID, and to the review also of all previously initiated containment measures has been done. So containment zones, screening, contact tracing, quarantine, all this has been reviewed. And high-risk persons to be monitored. Also, the role of police has been appreciated in helping in this fight against corona, and doctors and paramedical staff of the Central Armed Paramilitary Forces will be adding to the health workers in Delhi, and many of them will be airlifted to Delhi soon. So there's also to keep track of the patients in home isolation, and there's also help with quick shifting of those patients to COVID hospitals whenever necessary. And protocols for plasma donation in severe cases have been put in place, for which a high-level committee on plasma donation has been set up, and that committee will be headed by Dr. V.K. Paul. It will have the Director of AIIMS as well and Director General of ICMR in it, and they will be submitting a report. The central government will be providing oxygen cylinders and all other essential health infrastructure and equipment to Delhi, to the Delhi hospitals. Prevention requires people's cooperation, and hence that's a people's movement, so behavior change and all the negative impacts of not following the health norms have to be conveyed to the people through a dialogue. So 250 to 300 ICU beds will be added to DRDO's COVID hospital in Dala Kwan. And what has this hospital been doing? It is set up in July this year. Here's a look at the service it's been providing.
Defence Research and Development Organisation, or DRDO Sardar Vallabhbhai Patel Hospital, has been caring for and providing free of cost treatment to patients from COVID-19 gripped Delhi NCR. The 100 ICU, 150 HDU and 1000 bedded hospital was ready this July during the pandemic within a record time frame of 12 days with the help of the Home and Health Ministries, Paramilitary Forces and the Tata Trust.
DRDO has established COVID hospitals in Delhi, Patna and Muzaffarpur. In Delhi, it's a 1,000-bedded hospital with 250 ICU beds. Armed Forces Medical Services people are providing all the medical services. The hospitals are equipped with all the diagnostic facilities, pharmacy and other infrastructure which is required.
The DRDO recently named different wards of the COVID hospital after the martyrs of the Galwan Valley clash. The ICU and the ventilator ward has been named Colonel B. Santosh Babu Ward. So far, the hospital has treated 2,800 patients and nearly 2,370 have been cured and sent home. The hospital has 2 wards of 500 beds each, of which only 1 is occupied till now. The second 500-bed ward is also on standby for admitting patients from Delhi and nearby, where the COVID-infected can be given the best treatment whenever necessary.
All the people who come to this hospital are treated for COVID free of cost. Request all the people who are affected by the COVID may join in these hospitals and get well soon.
The patients admitted at the Sardar Vallabhbhai Patel COVID hospital say they're getting better treatment facilities here than at other places.
In the critical care, nurses are there in the ICU, and round the clock we are giving care in all the shifts, and it's a selfless service from us.
हम एक बहुत ही stringent disinfection procedure यहाँ follow करते हैं, जिसमें कि डेली 3 या 4 बार यहाँ पे surfaces की mopping की जाती है, वार्ड्स की फ्यूमिगेशन की जाती है, और साथ ही साथ हम ये भी प्रोसीजर फॉलो करते हैं कि यहाँ पे लोग प्रॉपरली ट्रेंड हों जितने भी डिसइंफेक्शन प्रोसीजर्स हैं उनके बारे में.
ट्रेनिंग फॉर ऑल दी पर्सनल इंक्लूडिंग मेडिकल ऑफिसर्स, नर्सिंग ऑफिसर्स, पैरामेडिकल स्टाफ, whoever is working here, including the housekeeping staff and the people who are engaged in biomedical waste management. So we had an extensive training of donning and doffing the entire pathophysiology of the disease to understand the concept of the disease.
There were some media reports recently that people have been having difficulty in getting bed and ICU facilities at the DRDO hospital. But at this point, only 404 patients are admitted at the hospital. 596 beds remain available for COVID-infected patients. In the case of ICUs, of the total capacity of 100 ICU beds, only 56 are occupied and 44 still remain available. With Sudhir Yadav in Delhi, Newsnight Desk, DD India.
So let's take stock of India's fight against COVID. Let's take a look at the total number of cases so far. We know that there are 88,14,579 cases in all, and that's a 41,000 increase. But look at the number of recovered. That's 82,05,728, which is 93.09%. And the active is only 4,79,216, which is 5.44%. So that really is the story. Now moving on then, we can look at the number of states that have COVID, and we can see actually, even though Maharashtra has 17,44,000 cases, the recovered is 16,12,000, and actually only about 5% are active, which is 86,470. And if we look at the percentage of active cases, we can see that Tamil Nadu is only 2%, Andhra Pradesh is 2%, Delhi has, Kerala has gone up to 15%, and we know that Delhi is about 9%, but all the others are, many of them are well below the average of 5%, which is in the state, in the country. Also, we look at the continuous decline in the average daily number of new cases for the last 5 weeks, and we can see that, from the 3rd of October till the 7th to the 13th of November that week, we can see a clear decline. And we can also see that the number of recoveries has been significantly higher than the number of new cases. And that has been, of course, declining because the number of cases too have been declining. So we can see that as of today. Also, we can see that 83% of the new cases have come from 10 states or union territories. Delhi accounting for 7,340 cases in the last 24 hours. And Kerala for 6,357, Maharashtra 4,237, and it goes down Andhra Pradesh to 1,657. So it's only these states that have accounted for 83% of the cases. So we can see that it is basically contained within certain areas of our country. And if we can control them there, then we are pretty much getting our act together. And we can also see that the recovered cases have been highest in all these states as well. So people are recovering fast, and so the process of recovery is also on in these particular states. Well, India fights corona, and we can see that the daily new cases remain below 50,000 as 1 million tests conducted daily. Now, this is the important thing, because it's not like, we have not tested. We are testing at if we look at from the 5th of November, we tested 12 lakh samples, and it was roughly about 10 lakh samples per day, just a few days where it went below. But over 10 lakh every day, 8 lakh was tested on the 15th of November, and that resulted in 41,100 cases. So that we can see is the particular, it's high number of testing, and we can see very few cases as well. So India is basically testing forward, and that's the strategy, which is very importantly based on testing and also still on tracking, tracing and treating. So we're going to take a short break, and then when we come back, we'll put it into context and try and understand the surge in Delhi and try and understand the measures that are being put in place to contain that surge in Delhi and look at the overall picture in our country as well. Stay with us.
A genius who is a law student but who has to his credits 2 patents. On DD Dialogue, we're featuring Devansh Jalan.
So my patent is essentially about using multiple smaller batteries and discharging them separately instead of discharging them all at one go.
Young people of India in the campuses of universities across India have the potential to transform the world. Devansh's achievement is part of a larger ecosystem that we in
And so that brings us to In Focus tonight, and In Focus is this: Delhi's growing case count and the centre's comprehensive strategy. And to talk us through this, we have with us eminent guests. We have Dr. Randeep Guleria, is the director of AIIMS. We have Professor K. Vijay Raghavan, Principal Scientific Advisor, Government of India, and Dr. S.K. Sareen is the Director, Institute of Liver and Biliary Sciences. Thanks very much, gentlemen, for being with us. Dr. Guleria, we'll start with you. We know that the cases have increased in Delhi because of pollution and suspended air, and the fact that, the virus can hang on to suspended particles. So, I mean, from the person's point of view, I mean, we understand that the government has put in place measures to augment infrastructure, but from people's point of view, how do they protect themselves?
So I think the most important thing that people need to do is what we call COVID appropriate behavior. And as we move into the 9th month of the pandemic, this has really come down significantly. There is a little bit of COVID fatigue, and especially now, as you rightly mentioned, during the winter months when respiratory viruses tend to peak, and COVID is a respiratory virus. And with air pollution in the Indo-Gangetic belt, we will have more cases because of this and more severe cases. Therefore, people have to be really more vigilant, and wearing a mask should be something that they must do religiously when they go out. They should avoid crowded places. We are seeing a large number of crowds gathering because of the festive season. These crowds can be what we call super spreading events, and this can lead to a huge increase in the cases. Possibly that is one of the reasons why we've seen this surge in cases as far as Delhi is concerned, because we have pictures from various markets and various functions where people have been not maintaining physical distance and are not even wearing the masks. This is an ideal situation for the virus to spread, especially during the winter months. So I think the most important thing here is that as we know that this weather and pollution is conducive to the spread of COVID-19, we have to take precautions that we don't allow this to happen. And the things that we need to do are simple. Always wear your mask. Don't feel shy about wearing a mask, and make sure others wear it and wear it properly. Maintain physical distancing. Avoid going to places which are crowded.
Right.
If you have to go to at times when there's chances that there's no crowd, And especially the elderly and the high risk people should actually not go to such places. And at the same time, hand sanitization should be regularly done. If we follow
Yes.
these measures, I'm sure we will continue to have a decline in the number of cases. On the other hand, if we don't do that, then we are likely to have super spreading events which will lead to a surge in the number of cases during the winter months.
Professor Vijay Raghavan, what lessons have we learnt with the interventions played by technology, especially the Arogya Setu app over the last 9 months? Certainly it has helped me a great deal, the Arogya Setu app. I know that, who are the people who are high risk and I stay away from them and things like that. But in general, how has it helped in information gathering and in the process of putting policy in place?
Well, the application has helped enormously, both in terms of what citizens see and also because of the enormous work the Ministry of IT and the Health Ministry do in terms of analyzing and acting on the data. In addition to the app, which has over 150 million users, the teams track all the positive cases which have telephone numbers attached to them and look at their contacts and assist in isolation. So this is an enormous amount of work, and they do this every day so that they see which districts, which towns, which regions are likely to become future hotspots and act with the local health administration to prevent that from happening. So that's been very helpful. But just as, Dr. Guleria referred to fatigue about following guidelines and rules of good behavior, similarly, people tend to take the testing, tracking, and isolation lightly. They shouldn't do that because this disease transmits from asymptomatic and pre-symptomatic people also. And therefore, great care should be taken if you are positive or come into contact with someone who's positive to get tested and isolated and go back in time and isolate all the contacts of the people who have been positive for a defined period. That will help crunch the spread dramatically.
Dr. Sareen, perhaps what has been in the minds of people besides the fatigue is also the sort of they get emboldened by the fact that the number of cases, the recoveries are so high, the case fatality rate is low, and people are taking the virus kind of slightly lightly because they think it's just, and many people don't even know that they have the virus and they've gone through it without even having any symptoms. So they think, are we really giving too much importance to this virus? What would you say to people like that?
Well, certainly, as Dr. Guleria and Dr. Vijay Raghavan have said, we really have some fatigue. I'll give you examples of first the doctors and then the public.
Yes.
The common now parlance is that people will finish work, now sit together, take off their masks and eat and speak. And if somebody speaks a little loudly, he can spread 1,000 viruses per minute, 1,000 copies of the virus. And people do have a habit of laughing, which is good in other times. Secondly, if the people are taking off the mask or speaking when they are doing, don't need to take off the mask. So one important message is that when you are together, never eat. Please speak with your mask on, not only to cover your nose, but also your mouth. Second part is the general public, when they are sitting or going up and down in the vehicles, they are getting into their car, they take off their mask before they enter the car or enter into the buses or into the metro. So that needs to be remembered. Third part, the fatigue part. I think the fatigue is also partly because people have started thinking that the virus will disappear maybe by end of winter or early, whenever the vaccine comes. This is not going to happen. And COVID appropriate behavior is our responsibility. The government cannot bring that behavioral change. The mindset has to be clear. We are in the danger zone, and especially in several cities like Delhi. Why has it increased? People are, enjoying with crackers. These crackers will take the virus to far away. The air will go, they polluted, the smog and the contained virus. It can go to hundreds of feet, not just the physical distancing. So please remember, such events have to be actually abundant and not even thought of. I would also say that people need to be careful about elderly people. They are the ones who are very, very vulnerable. We need to see that if there is somebody in the family, do look after. Now, this is to some extent a community spread. Contact tracing had a value. We still have Arogya Setu, which is going to be very helpful. But do remember that now we are in a phase that we cannot always identify. So the only way to protect yourself when you cannot identify the contact is the mask. So please have a good mask. You can use double mask. You can have a N95 mask if you are going to a hospital. That is a very important part.
Dr. Gulerio, you are part of a committee that has been set up today to look at plasma donation, and how effective has plasma donation been so far, the plasma therapy, in containing or in curing COVID?
I think plasma therapy does have a role as far as the management of COVID-19 is concerned. The two important issues here are that when we're looking at plasma, it has to be what we call convalescent plasma rather than plasma itself. And therefore, when we have a person who has recovered from COVID and is now wanting to give his blood or plasma to another patient, we have to make sure that there are sufficient titers of antibodies present in that plasma so that it will be effective when we give it to a person who's suffering from COVID-19. And we know that there are certain people who recover, especially those who have mild infection, who don't have a very high antibody titer, and therefore their plasma may not be that good as far as giving it to a sick person is concerned. The second point is that it has to be given at a proper time frame. We have to give it early in the disease when the body itself has not formed enough antibodies to fight the virus. If we give this plasma very late in the course of the disease, then studies have shown, and there is a very nice paper even from the Netherlands, which show that after 10th or 12th day, the person himself had sufficient antibodies in his own blood that giving plasma from outside was not of much use. And therefore, we have to really see that when we're giving plasma to an individual, we give it early and that plasma has sufficient antibodies. So I think we really need to relook at our strategy because there has been a lot of controversy around convalescent plasma. I personally feel that it still has a role. We should still consider it, but we should give it properly, and it should be plasma which has been tested in a right manner.
Professor Vijay Raghavan, life has turned, it's almost back to normal in certain, let's say, bio bubbles in a sense, which have been created, and that has also been done because of technology. To what extent, has this been successful, and how do you foresee that this is going to be a way of life if things are going to proceed until we have a proper cure, which and everyone can get back to normal? But most people and analysts say that we're never going to get back there because we are coexisting with this virus for the foreseeable future. So is this going to be something that we're going to be technology driven? We're going to have something on our phones that will tell us that we are clean and we can move into this area? Is that something that we are thinking of?
Well, first of all, one should not take a dismal view at all. We have this with us, and we should take an appropriate view. There are two kinds of appropriate things. One, what is within our hands, and you've heard about that. But there's also rather dramatic outcomes coming from science. And these fall into two kinds. One, testing is becoming more and more readily available. As every day goes by, we're getting better and better tests, which are more rapid and also more sensitive and specific. And this allows, for example, in offices, in housing colonies, in factories, for airlines, rapid testing will start taking place and will become normal. You can be tested very frequently at very low cost. India has excelled in the development of some of these kits. Most notably, there's one by the CSIR's Institute for Genomics and Integrative Biology, which is now being commercialized in partnership with the industrial hubs. And this is a very rapid and accurate test. There are other tests also. So testing will allow us to be aware on a week-to-week or day-to-day basis whether it's safe. This allows, in turn, the formation of bubbles of various kinds so that we can mix our lives and livelihood together. Go to work and come back and be tested. Be at home and be tested in your housing colonies and function reasonably effectively.
Dr. Sareen, you did mention about elderly people, and the government in these guidelines that have come out today has talked about in Delhi to monitor people who are vulnerable. How do you think this can actually be done? I mean, do we have record of everybody who has comorbidities, and people will have to be put into some sort of special monitoring for it to be truly effective?
It's a very important question, and this is the responsibility of the family. If you know that your parents or your elderly colleagues have diabetes, blood pressure, they're above 65, they're overweight, they have a heart disease, or they have a kind of malignancy, you may not call it a tumor, malignancy. These are people who are on chemotherapy or steroids or something. These are the people who are very vulnerable. I think, and also in elderly, the oxygen saturation is generally rather a little low. So I would suggest that they should all have an oximeter at home, which can give you reliably the pulse rate. If it goes above 100, it is a cause of worry. If oxygen goes below 93%, it is a cause of concern. If it goes below 90, certainly you need to have a medical help around. So if you monitor them well, say suppose somebody, your friend of elderly parents have got COVID, there is no need of panic. Everyone, 80-year-old does not need to go to a hospital, but you just need to monitor. Yes. So I want to also assure the public, don't rush everybody above 65 or with comorbidity to a hospital. If they have no symptoms or they have very mild disease, be cautious. Yes, they are under higher category of monitoring. They may be in contact with a hospital or a COVID care setup, not a hospital necessarily. Morbidity is high in them because of multiple reasons. So we all know that, but I think it is also important for us to know that everybody does not need steroids, which is sometimes a little harmful. I think moderate or severe disease only needs steroids.
Dr. Guleria, so the key is actually also on oxygen supply and the availability of oxygen supply that needs to be made available. There was this possibility that oxygen could be supplied to people's homes because, rather than immediately, suppose they suddenly need it and they have to suddenly be sent to a hospital, rather than that, could they, be actually given oxygen at home? Is that a possibility? I'm just thinking out of the box here.
No, I don't think that is a possibility. As has been said, we need to monitor individuals at home closely, because if the saturation falls, then they will need to be in hospital, because besides oxygen, there are other things that may need to be started, because then this individual has moved from mild disease to moderate disease and then may need to have additional therapy, will need to be closely monitored. And sometimes we do other things like positioning of the patient so that the oxygen saturation can improve. So anyone whose saturation starts falling, especially if it is less than 90 or starts going below 93 and has comorbidities or is in a high risk group, it's better that he is monitored in a hospital. It need not be an ICU. It can be even a COVID hospital. But it's important that these patients are monitored in a hospital.
Actually, my question, Dr. Guleria, was about the time. In fact, amongst these key points that was discussed today is that people should be moved very quickly to from care centers to hospitals when necessary, because some people who are asymptomatic, suddenly they develop this oxygen saturation and they can actually die, and within that span of time could they be moved very quickly. So in these areas, could they actually have something that can shore them up in the meantime?
I think the most important thing here is monitoring, because what has been noticed is that often patients sometimes delay coming to a hospital, especially if they're on home isolation, and when they come into the hospital, they are actually almost in a gasping state. And one of the causes of high mortality has been late reporting to hospitals, especially those people who are staying at home. And that is why monitoring yourself is important. Staying in touch with your doctor on a regular basis is important. And if you have a fall in saturation on any of the warning signs, you must immediately go to the hospital, even if there is a little bit of a concern, because like you rightly said, you can suddenly have a fall in saturation, and that can be catastrophic, because you can suddenly then land up in a ventilator rather than having appropriate treatment, which could have avoided this. So I think it's very important that those who are monitoring themselves at home do it very religiously, stay in touch with the doctor, and if there is any warning sign that they are going from mild to moderate disease, it's better that they get admitted, even if it's in just a COVID hospital rather than in a COVID ICU or a critical care center.
Professor Vijay Raghavan, we have increased, of course, testing, and but there's in today's guidelines there's a doubling of RT-PCR tests. Were the other tests, not as effective, and did they give us some sort of false, false negatives in a sense?
Well, different kinds of tests have different values depending on the context. When the load in a given region is low, the RT-PCR test is very valuable because it has got very high sensitivity and specificity. It's sort of a gold standard.
Yes.
As the load in a given area increases, one can, because of the increased prevalence, have quicker tests which are not as sensitive, but because there is prevalence in a region, they are okay. And so there's nothing wrong in using them, and they can also be used frequently. So it depends on the context, and the rapid antigen test has been very, very valuable.
Fair enough. A final word from you, Dr. Sareen. It's been 8-9 months and we've learned a great deal. So in the end, do you think that, we put all the best practices into place and we are prepared, for any further situation that can occur in the future similar to this?
Well, I would say the final word is only from God, and only He knows what is going to happen. But since we know that it is not near, I think, and I am afraid, there can be multiple waves, not one, all across India today. Delhi seeing, maybe tomorrow another city or state sees. So I would say through you, which has the farthest reach, DD, that people should be clearly aware and do 3 things very cautiously. One is to wear the mask and never to take it out from nose as well as face. Have a distance, and also wash your hands and keep the hygiene. And if there is anybody around without a mask, please educate them to wear a mask. And of course, do not wait till you become very sick. Please be sure also not to rush to a hospital when you are not sick. Don't crowd the hospital. And I think plasma therapy does have a role. Everyone should think when to give it. It's not a magic bullet, but it is certainly, if it has good neutralizing antibodies, about 640, it's a very good product given early enough. Well, I also think that government has done enough. Now public, the general public has to do much more. It's a war.
It's a collective effort of both the government and the people, and we have to thank all our doctors, our corona warriors in a sense, who have been at the forefront of this fight. Thank you very much, Dr. Randeep Guleria, Dr. S.K. Sareen and Professor Vijay Raghavan for joining us and throwing light on this important fight that we all continue to fight every day. Moving on then, in Jammu and Kashmir, the JK Kashmir Frontier, the BSF paid last respects to the senior Inspector Rakesh Dobhal of the 1011 BSF Artillery Regiment, who made the supreme sacrifice in the line of duty on Friday. Inspector General Kashmir Inspector General of the Kashmir Frontier BSF, Dr. Rajesh Mishra, led the floral tributes paying ceremony at the Kashmir Frontier BSF headquarters, and the subordinate officers and other ranks of the Kashmir Frontier and dignitaries from other forces and civil administration also paid homage to the departed braveheart. The Ministry of External Affairs has rejected Pakistan's claims of proof against India and termed their claim as anti-India propaganda. In response to media queries on the press conference by Pakistan's Ministry of Foreign Affairs and the establishment, the official spokesperson Anurag Srivastav said, "This is yet another futile anti-India propaganda exercise. The so-called claims of proof against India enjoy no credibility, are fabricated and represent figments of imagination. This desperate attempt will find few takers, as the international community is aware of Pakistan's tactics and proof of its terror sponsorship has been admitted by none other than its own leadership. The incessant infiltration of terrorists and induction of weapons to fuel terror activities continues unabated. Such activities are not possible without the support of Pakistani forces deployed along the LOC." The press conference was a deliberate attempt on the part of the Pakistani establishment to shift focus from its internal political and economic failures. We call upon Pakistan to end its support to cross-border terrorism. Pakistani leaders have never hidden the fact that it has become a factory for producing terrorists. Concocting documents and peddling false narratives will not absolve Pakistan of such actions. The legendary Bengali film actor and Dadasaheb Phalke awardee Soumitra Chatterjee passed away at the age of 85. He was the star of many Satyajit Ray films and acted in around 300 movies.
Baba? Oh, Baba.
টুকুন জল থেকে তাহলে উঠে এলি
জল থেকে
হাজার হাজার ফিট জলের নিচে তো ছিলি
85-year-old cinema and theatre legend Soumitra Chatterjee passed away after suffering from COVID-19 infection since October 6. He was known as one of the finest actors in post-independence Indian cinema. Chatterjee is more known in the film world as the Oscar-winning director Satyajit Ray's favourite hero. Chatterjee acted in 14 of Ray's 34 films, besides 2 documentaries, and in over 300 films in his 6 decades-long career since debuting in Satyajit Ray's Apur Sansar, 1959.
তোমার অনুশোচনা হয় না
কি হয় না
অনুশোচনা
অত শক্ত কথা বুঝি না
আফসোস বোঝো আফসোস
বুঝি
আফসোস হয় না
কিসের আফসোস
Chatterjee also acted in 4 films by Mrinal Sen, another of India's art house filmmakers with international fame. Punascha, 1961, Pratinidhi, 1964, Akash Kusum, 1965, and Maha Prathibi, 1991. He worked with reputed directors Tapan Sinha, Ajay Khar and Asit Sen as well. Recently, despite his advanced age, Chatterjee had been active and taking part in the shooting of 2 films, including his own biopic, after film production resumed with the relaxation of lockdown norms in July. He also took part in a docu-feature on his life currently under production. A dashing, good-looking actor with impeccable pronunciation, Chatterjee's thinking persona perhaps had a great influence on the characters he played in movies. Critics noted that his low-pitch, naturalistic acting and expressions of finer sensibilities reflected a kind of urban intelligence that became the trademark of Chatterjee's, whether in the genre of parallel cinema or in the role of matinee idol. Chatterjee never stepped out of Kolkata to try out the waters of Bollywood. He had said in interviews that he did not need Bollywood for fame because Ray's films had already earned him international recognition, and the roles that mainstream Bollywood films could offer never interested him. Despite his ever-growing association with the Bengali film industry, theatre remained so integral to his life. As the news came in, President, Prime Minister, along with celebrities, fans and dignitaries from all areas expressed their grief. President wrote on Twitter, Soumitra Chatterjee's performances won him several national and international awards, including Dadasaheb Phalke Award, Padma Bhushan and Legion d'Honneur. Condolences to his family, the film fraternity and millions of fans across the world. Prime Minister also tweeted, Shri Soumitra Chatterjee's death is a colossal loss to the world of cinema, cultural life of West Bengal and India. Through his works, he came to embody Bengali sensibilities, emotions and ethos. Anguished by his demise, condolences to his family and admirers, Om Shanti. INB Minister Prakash Javadekar tweets, the passing away of the iconic Bengali actor Soumitra Chatterjee is a big loss to the film industry. Heartfelt condolences to his family, friends and fans. Om Shanti. Chatterjee was honoured with the Dadasaheb Phalke, India's highest award in cinema in 2012, Padma Bhushan 2004 and the Sangeet Natak Academy Award 1999. In 1999, Chatterjee became the first Indian actor to receive the French distinction Commander of the Order of Arts and Letters. He received the highest French civilian honour, Legion d'Honneur, in 2018.
তার ভিতরে মহৎ একটা কিছু করার ক্ষমতা আছে, সম্ভাবনা আছে, কিন্তু করছে না কিন্তু সেটি শেষ কথা না, সেটি ট্র্যাজেডিও না।
With inputs from Jyotika Grover, Bureau Report, DD India.
কিন্তু তা সত্ত্বেও সে জীবন বিমুখ হচ্ছে না, সে পালাচ্ছে না, এসকেপ করছে না, সে বাঁচতে চাইছে।
The end of an era there. Well, Diwali was celebrated across the world with great enthusiasm. The US President-elect Joe Biden, besides several world leaders, also greeted people on the occasion of Diwali.
Diwali celebrations continued across the world as the West woke up to the Festival of Lights. US President-elect Joe Biden shared greetings on Twitter. He wrote, "To the millions of Hindus, Jain, Sikhs and Buddhists celebrating the Festival of Lights, Dr. Biden and I send our best wishes for a happy Diwali. May your new year be filled with hope, happiness and prosperity. Saal Mubarak." Vice President-elect Kamala Harris also tweeted, "Happy Diwali and Saal Mubarak. Douglas M. Hoff and I wish everyone celebrating around the world a safe, healthy and joyous new year." In a joint statement, Biden and Harris said, "Like so many cherished traditions during the pandemic, we know this year's Diwali and its symbolizing of light over darkness, knowledge over ignorance and empathy over apathy arrives with a deeper meaning." US President Donald Trump also shared a picture of him lighting a lamp in the White House along with Indian American members of his administration. "Happy Diwali" was written on the photo. In his Diwali greetings, he said, "During this festival of lights, friends, neighbors and loved ones join in fellowship to commemorate the spiritual triumph of good over evil, light over darkness and knowledge over ignorance. As diyas are lit throughout homes, workplaces, communities and places of worship, their warmth reminds us of the hope and devotion that faith and tradition bring into our lives." The iconic Empire State Building in New York was lit up in orange to commemorate Diwali. The Federation of Indian Associations of the Tri-State area of New York, New Jersey and Connecticut, the leading umbrella community organization in the US, partnering with the Empire State Building, marked the Festival of Lights by illuminating the iconic Manhattan building. Diwali was also celebrated in the United Kingdom. Finance Minister and UK Chancellor Rishi Sunak marked the festival of Diwali by stepping out of his number 11 Downing Street home in London to lay out a Rangoli decoration and light 4 diyas at the doorstep. The 40-year-old Indian origin finance minister is married to Akshata Murthy, the daughter of Infosys co-founder Narayana Murthy. Earlier, UK Prime Minister Boris Johnson shared his Diwali message on the social media.
Namaste and happy Diwali, everybody. All over the world, millions of lamps are once again being lit as the spectacular, joyful festival of Diwali is here to burst through the autumnal darkness. And of course, I know that this year, as with so many other events, Diwali is not going to be the same. People across this country are making huge sacrifices. This year, perhaps more than any other, Diwali holds a potent meaning for all of us. And just as Diwali celebrates the victory of light over darkness, good over evil, knowledge over ignorance, so too I have every confidence that we shall triumph over COVID-19.
Canadian Prime Minister Justin Trudeau also participated in a virtual version of the annual Diwali celebrations, lighting up a ceremonial lamp from his office in Ottawa. He tweeted, "Happy Diwali, I know celebrations will look different this year, but the message at the heart of the day, that light, hope and knowledge will always triumph over darkness, evil and ignorance, remains the same and it has never been more important."
At the heart of this festival is the idea that light, good, and knowledge will always triumph over darkness, evil, and ignorance. And as we continue to deal with the impacts of the pandemic, this message couldn't be more important. For all of us, Diwali is an opportunity to recognize the contributions that your communities make to our country every single day. I want to take a moment to thank everyone working on the front lines in healthcare, our essential services, and the local organizations that have been there for us.
In Dubai, Diwali was celebrated according to the guidelines issued keeping in mind the coronavirus pandemic. Dubai's tallest building, the Burj Khalifa, was lit up and a Happy Diwali message was inscribed in lights. In Pakistan too, Hindus celebrated the Festival of Lights. The Hindu community in Karachi celebrated Diwali while following the protocols set to prevent the spread of coronavirus. Karachi's Swaminarayan Temple was illuminated to mark the occasion. Newsnight Desk, DD India.
Well, President Donald Trump of the United States appeared to acknowledge publicly for the first time on Sunday that Democrat Joe Biden had won the November 3rd U.S. presidential election, but said that he was not conceding and asserted that the election was rigged, reiterating his false claims so far of widespread voting fraud. He later tweeted that he concedes nothing. Biden defeated Trump by winning a series of battleground states that the Republican incumbent had won in 2016. The Democratic former vice president also won the national popular vote by more than 5.5 million votes, or 3.6 percentage points. Biden has won 306 votes in the state-by-state electoral college system that determines the presidential winner, according to Edison Research, which is far more than the 270 needed to secure a majority. Well, one person was stabbed and at least 10 people were arrested after a fight broke out in Washington, D.C. on Saturday between supporters of U.S. President Donald Trump and counter-protesters. The melee occurred following a march through downtown Washington by tens of thousands of Trump supporters, echoing his unsubstantiated claims thus far of election fraud. The city's police department had made 10 arrests by mid-afternoon, including 4 for firearm violations, 2 for assault, and 1 for assaulting an officer. The Regional Comprehensive Economic Partnership, the RCEP agreement, was signed among its 15 participating countries Sunday, launching the world's biggest free trade bloc. The participating countries are the 10-member countries of the Association of Southeast Asian Nations and China, Japan, South Korea, Australia and New Zealand. The 15 participating countries of the RCEP account for around 30% of global population, global gross domestic product and global trade. The signing came after more than 30 rounds of negotiation, which were launched in November of 2012, as well as a number of specific leaders and ministerial meetings between the participating countries. And that's all we have in Newsnight for tonight, but remember that we're going through tough times and it's always better to have your mask. It's always wise and safe. It's a simple task, in fact. Just wear a mask and keep yourself safe and all those around you safe. Thanks for watching. Namaskar.